So I've also highlighted a few low-hanging fruits that also need to be addressed. And by low-hanging is something that you can, I mean it metaphorically. So of course, this is something that you can address just very quickly, right? It's very easy to correct all of these. And the first one we'll be talking about is micronutrient deficiencies. So you have vitamin A. Now, vitamin A deficiency is usually seen in rural areas of people belonging to a lower socioeconomic status. So, of course, pregnant women who are deficient in vitamin A, their infants can get vitamin A deficiency, and of course that can lead to a lot of defects in the eyes as well, which are sometimes unfortunately irreversible, right? So beyond, so of course, if there is a severe deficiency, the first thing would be to take a supplement. However, it's also important to take vitamin A adequately from your diet. So any of your dark green leafy vegetables, any orange colored vegetables like your pumpkin, carrots, sweet potatoes, so they all contain the inactive form of vitamin A, which is beta carotene, and then it gets converted into the active form into your body. Okay, we also have vitamin D, B12, and iron. Now these are also being seen in urban cities as well, because we're sitting indoors all the time. We're in a closed environment. We're not really going out in the sun and sunbathing, or else we've applied sunscreen. So these deficiencies are extremely common nowadays. So vegans and vegetarians, they do require supplementation if because these are not really found in a lot of food sources. Vitamin D, particularly, you get it from the sunlight. You also get it from a few other, foods like eggs, mushrooms that are exposed to the sunlight. They also get activated with vitamin D. So that's another way for a vegan or a vegetarian to get some vitamin D from. Beyond that, it's mostly found in non-vegetarian sources. Vitamin D also, for that matter, is mostly found in animal sources, and you do not see much of it in plant-based sources. Iron, again, is, you do get, you might be thinking iron, yes, I can get it from spinach, things like beetroot and so on, but these contain something called non-heme iron, which is not very easily absorbable by your body compared to iron that you get from an animal-based source. So something that you get from chicken or meat, for that matter, that's your heme iron. So it's more bioavailable for your body, and your body can absorb it much more easily than iron that you would get from a plant-based source. So of course, if you are deficient, it would require supplementation. However, iron status is very closely related to your gut health as well. So it's important to also keep your gut health in check, and that can also help improve iron status. But vitamin D and B12, very, very crucial to start supplementing, very crucial to get yourself tested in the first place. Because if you're doing a routine blood test, which I recommend once every year, these deficiencies, you must get them included in your set of blood work that you're doing, and watch out for these. And if you're deficient, go visit a doctor and ask them whether you can get injected or if you can take a supplement, because these are very crucial. And I myself have personally witnessed increase when I've been deficient, and how lethargic it made me feel when I was deficient in both D and B12. And supplementing just made things so much easier. All right. Another very simple thing that can be done is improving gut health. Now, gut health is a huge area that is being constantly studied, and of course, it's a very nuanced field, and there's a lot of things that need to be done in order to improve gut health. But today, since I'm talking about low-hanging fruits, I'm going to be speaking about something that's very simple, which is deworming. So deworming is something that is mandatory for young children to be done. However, for adults also, there's no harm in taking a deworming tablet once every 6 months, right? And of course, probiotics. So anytime you are prescribed with, with antibiotics if you have any viral fever or anything of that sort. It's always good to take a dose of probiotics as well, so that, because when you're taking your antibiotics, it is depleting the good bacteria in your gut as well. So it's good to take probiotics that will replenish all of that good bacteria in your gut once again. Right? So again, very simple steps. And probiotics, there's a lot of companies that are emerging that sell these probiotics. But of course, you do get like a very simple few strains of probiotics from your local chemist as well. So there's no harm in taking a probiotic just to make sure that things are going well in your gut. Of course, increasing fiber intake is very important. Like we looked at previously, Indians are not taking enough of fruits and vegetables. So yes, it's important to increase your fiber intake there. Fiber also comes in from things like legumes and pulses. So your rajma, chana, all of these are extremely good for your gut health, and they also contain a good amount of fiber. Now, speaking of fiber, I also want to highlight that we're getting, because of eating the wrong kind of foods, which are low in fiber, again, that is disrupting our guts. So if you eat something like maida, if you're eating a bread, white bread, or if you're eating some, a pav or a bun, so that's basically wheat with the fiber taken off of it, right? So that's your maida, and that's going to also again lead to a spike in your blood sugar levels, which you do not want. So again, speaking of fiber, yes, taking it from all of these whole foods, so any whole grains, like you have your whole wheat atta that you use regularly to make your chapatis, that is one source. But beyond that, it's also important to look at consuming enough of fruits and vegetables. Okay. Again, speaking of, so improving your gut health again. So it's also important to take in your nutrients from a very diversified diet, right? So taking in your fruits, vegetables, cereals from different sources. So you're looking at climate smart crops, like you have your millets and pulses, that are grown in specific climates. For example, in the winter, like the winter is now gone, but winter is especially good for having bajra, which is commonly grown at that time. And in the summer, you can possibly switch to grains like jowar, ragi, and so on, right? Of course, always good to have local and seasonal fruits and vegetables. So, instead of haggling with the local fruit seller for, reducing the price of an avocado or some blueberries, it's always good to buy whatever seasonal fruits are grown in your area and have those, okay? Also, it's very good to eat the rainbows. If you're learning nutrition or if you are a future nutritionist, just bear this in mind. This is like the golden rule of nutrition, eating the rainbow. So what I mean by that is eating a variety of fruits and vegetables which represent the colors of the rainbow. So that way you ensure that you're getting in most amount of micronutrients, and you're getting a varied diet. So a varied diet in which you're eating a lot of different variety of foods is always good for your gut.